Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott Anderson. August is Medicalert Awareness Month. Preparing for unforeseen emergencies, however, is really a year-round challenge. If you or a loved one is stricken with an emergency, will you or your doctors or your nurses have all the information they need to take care of you? I'm talking things like your name, your age, but also your medical history. Let's say, for example, that you have diabetes or a heart condition or a thyroid disease. This might be critical knowledge. Having this information might allow healthcare providers to save your life. So join us as we explore Medicalert Awareness Month with our guest, Medic Ambulance Vice President of Operations, Jimmy Pierson. Jimmy, it's just a real pleasure to have you here on Health Focus.
Thank you so much for having me.
And I know that you actually ran here directly from an emergency on I-80 that ended tragically. It makes the point, though, that you're always on call, really, in a sense, and you're always there helping the community.
Always, always.
And we know that you and your fellow workers at Medic Ambulance, your fellow professionals, are really active members of the community in so many ways, reaching out to educate members of the public and also serving as a Rotarian and in other functions. So we really appreciate all that you do and that everything your colleagues do for the community.
Thank you. Thank you very much.
Now, could you tell us a little bit, Jimmy, just about how you became a paramedic? What drew you to this field of public service? How you got into it?
So I've had the privilege of growing up in a family business. The family business just happened to be ambulance service. My grandparents, my uncle, Rudy Manfredi, started Medic in 1979 with 4 employees and 2 ambulances. And all my summers were at Medic growing up, and it started with washing ambulances for, a quarter, or doing all, the things that just being around, having the privilege to see my family work hard. And I just got drew to not just the flashing lights and sirens of it all, but being in dispatch when I was a kid and seeing my aunt and the different people and just how it impacted lives. And so, and then all the workers, we're just a big family. And so I got to know them all. And when they'd come back from a call, you'd hear the stories. And what, that's something I think, as I get older, I think that's something I want to do. So when I turned 18, or 17 actually, I started restocking ambulances and became a dispatcher on my own and was like, I think this is what I want to do. And then I became an EMT and loved it. It wasn't just like, this is a family business. I actually just loved what being an EMT and it was all about. So the next step was being a paramedic for me. And then now, 13 years later as a paramedic, I couldn't ask for a better job. Now as an owner-operator of a family business, it's a different level, and it's not always just about being a paramedic. You got to look at the full scope, which is obviously health awareness.
As a physician, I'm used to all these abbreviations, and we love abbreviations in America. We have EMT, and so forth. But many members of the public may not really fully comprehend what these terms mean. So perhaps you can tell us, what does EMT stand for? What is an EMT?
Got it.
And what does a paramedic really bring to the table that is an even higher level of education?
Great. In EMS, we talk acronyms all the time, and I catch myself doing that. But an EMT is an emergency medical technician. Okay. There's really 3 levels. There's the first responder, then there's emergency medical technician, and then a paramedic. And EMT gives you that, bigger, broader knowledge of understanding what a medical emergency is, how to stop bleeding, the proper way to do CPR, to really be there in an emergency. And the ambulances that we run in Solano County we have BLS, basic life support ambulances, and advanced life support ambulances, and critical care, which is nurses. But paramedics run the advanced life support ambulances, and EMTs are the basic life support ambulances. So when you become a paramedic, though, you go to a little bit longer schooling, have to do a field internship, time with a doctor in a hospital as well. And you can do you learn the drugs, the pharmacology of it, the cardiac awareness, understanding, the more physiological process understanding and how to treat with drugs and, your heart monitor and all those things in a major emergency. So, we all have our important roles, but paramedics just have a little bit more in their toolbox than an EMT.
And I know that Medic Ambulance has been around since 4 decades ago. I believe your shirt says it all. Excellence since 1979. Mm-hmm. So that's really a long pedigree of serving in this field.
Absolutely. It's a testament to my uncle, my grandparents, my mom, my Aunt Marisa, who also were a part of the business. And then now my sister, who's a nurse practitioner, runs our quality department. My other sister runs our communications. And then Rudy's stepdaughter, Christy, runs our financial department. So we're really unique that we have a third generation that was trained in depth by our second generation, and that we're, ready to go. So hopefully we'll have 4 more decades of service.
Hopefully so. Now, if someone picks up the phone and calls 911, is that person liable to get a private company such as Medic Ambulance, or actually isn't it more likely that the fire department will arrive?
So it's a dynamic of, in our system in Solano County, and actually in 80% of the communities around the state of California, you'll get a private ambulance service with a fire department engine. And but usually whenever a 911 is called, you're going to get a fire department response along with an ambulance response.
Okay. And in terms of actually getting credentialed as a paramedic, it takes a couple of years, or?
Yeah, so the process, you need to be an EMT first.
Right.
Some schools actually require hours as an EMT before you become a paramedic, before you can go to school. And then most schools are, 6 to 7 months of in work, in course didactic time. So time in the books, passing tests, and cramming and studying. And then there's another 2 months of your clinical time where you're in the hospital with the physician, in the labor and delivery room, in the emergency department, and then another 3 months with another paramedic.
So it's a long haul.
Yeah.
Now, I know you do some community outreach and education that's very important as public service, and we have a film that we'd like to show about your work. As we introduce the film, do you have any comments to make to kind of put it in perspective?
Yeah, so this is a great program that we started about 3.5 years ago with North Bay Healthcare. It's a pilot program. It's called Community Paramedicine. It's where we send highly, specifically trained paramedics. They're outside of the realm we talked about of that toolbox of treating with an emergency right away. We actually work with North Bay's team and the patient inside their home with congestive heart failure and COPD, and we work with those patients inside their home so that they don't go back to the hospital. And we try and give them a resource, a community resource that can really benefit them.
And that's so important because there's more than just picking people up and taking them to the hospital. We want to really foster good health. That's what Health Focus is about. That's what your career is about, to keep people out of the hospital and to keep people healthy.
Absolutely.
So let's take a look at some of the fine work you do. Let's roll this film. What is the title of the film again?
It's just Community Paramedicine. It's a Community Paramedicine program, and it's with us in North Bay. So
okay,
really,
so this
nothing
is
special. It's on a title.
I think our viewers are going to view it as something special. Yeah. This is a view of Medic Ambulance working with local medical personnel to try to educate members of the community on how paramedics can really foster a dialogue with individuals and help keep them healthy and out of the hospital. So let's take a look at it.
Medic Dispatch, Cameron speaking.
What we saw on the 12 lead was I'm the medical director for Medic Ambulance, and the state was looking for demonstration projects in the community medicine area. We felt this was a great way to demonstrate the triple aim of the Accountable Care Act, and that is to improve patient experience, improve population health, and decrease per capita costs. Basically, this program works on keeping patients that are recently admitted to the hospital out of the hospital. So many times there's been a failure of the medical care system that patients get discharged and then readmitted over and over again. This program works to decrease those readmissions. That improves patient experience because the patients want to be at home and they don't want to be sick, and this program does a perfect job of that, and I think will really demonstrate the real value of community paramedicine.
I think that's something that we've done phenomenally as two organizations over the last 18 to 24 months, literally finding out what they need and what their patients need, and how can we use this program, the state-of-the-art, innovative, whatever words you want to use this program to meet those needs.
I'm a heart failure complex case manager for North Bay, and one of the things that I and my coworker do, we evaluate patients for our program or for Medic's program, and if they meet If they're appropriate to be referred to Medic, then we work on providing that referral. We also make sure that the primary care physician and the appropriate specialist are aware of what's going on with their patients as well.
I think that Medic's community paramedic program was well thought out. The paramedics seem to have the most appropriate education in terms of the chronicity of disease, and I think they're able to address the patient's concerns regarding discharge, effective discharge plans, perhaps voids in their understanding of their disease process. They connect patients with community providers, with our providers. They alert us if there's any issues with care coordination. It's been only positive outcomes.
She moved here from Texas a few months ago, and she came out here with very limited resources. One of the first things I helped her do was establish insurance to the state of California, and that's a lot of in-depth phone calls, which she had no experience making. After that, helped her establish a primary care physician. Unfortunately, primary doctors only give you a month and a half till the next appointment, so through the state I was able to get her special insurance, which allowed her to get a next day appointment so she could get her medications. One of the big issues was when she came out from Texas, she only had approximately 2 to 3 weeks worth of medications, so that wasn't going to last a month and a half, and she has a lot of concerns that need to be managed by those meds. So with that next day appointment, she was able to get all those prescriptions refilled, keep everything flowing like it should. After that, I helped her set up further pulmonologist, cardiologist appointments, etc.
They're there for you, and they will help you through and take care of the business part and calls. And
it's amazing how much improvement you can see in her face, the life that came back in a month's time.
When he had to leave at the end, I didn't want him to go yet. So he was a great help to me.
When you talk to somebody, you get more than just those 10 minutes scene times, you get 2 hours. You can get to know them, get to know their ins and outs and the issues, and it really allows you to get deep into why are these people having trouble? What is this little problem that's being compounded, and then it results in them going to the hospital? And once you find that, you can try and help fix it as best you can.
If I get sick, they're gonna be there for me, and that I'm not alone, and that there's somebody that's gonna be there. Like I know if I go back in the hospital and get out, I'm sure Cliff or somebody will probably come and help me out again.
So when I first heard about the initiative, I'll admit I was a skeptic. I was not sure how we could take on this project with current staffing. I thought this would be way too much work for the case management staff to take on. I just did not see how we could possibly do this. I didn't think it was going to be enough value add for North Bay to take on. So I was a skeptic.
When you're a paramedic, you're trained to get into a house, be there in as little time as you can and get that patient to the hospital. What's different about this program is you're actually trained the exact opposite. You go into a house and you're there for an hour, 2 hours. You're going over everything with the patient, all of their medications, all of their diseases, explaining the disease and the disease processes to those patients, and just really getting to know the patient on a one-on-one basis rather than a 10 minutes inside the house, a 5-minute transport to the emergency room, and then drop off, where your total time with the patient is 20, 30 minutes. Now it's 2 hours, 3 hours, and you actually develop a relationship with that patient and want to see the patient succeed and want to see the health of the patient improve.
Then I did more research, just a Google search, and saw the state of Texas had been doing this for a while. There's other counties in California that have similar pilots going on, and then started to be less of a naysayer and open to the possibility of this could work for our North Bay patients. So, and then meeting Jimmy, that helped as well. Then going out to the Medic office in Vallejo and seeing how organized they were around the pilot, that really helped as well.
North Bay is vital to us being successful as a program. We have to work collaboratively with them and their team to ensure that we're meeting the needs of their patients.
The communication between North Bay and Medic Ambulance has been stellar. I pick up the phone and I'm speaking directly to the case managers that are dealing with the patients firsthand in the hospital, helping coordinate their care. They're on the phone to me on a very regular basis. We have each other's direct lines, and there's a great communication to make sure that the patients don't fall through any of the cracks.
There's so many patients that could use our services and medic services, so that we do have to really evaluate who we feel that are the most appropriate and who really need us more urgently. So that's why it's so good that medic's there, so that they can pick up some of the patients that we cannot follow, and we can team up and make sure these patients get what they need to succeed.
If there's anything outside of the ordinary, any unforeseen problems, whether they need a pain management clinic or they have a lapse in their insurance coverage, anything like that, they're on the phone with me immediately, and I'm immediately on the phone with their case managers at North Bay, and as a team, we figure out what we need to do for this patient, coordinate their care, follow up with it, and we don't call it case closed until all their needs are met.
Bringing the education into the patient's homes is paramount here. And that is something that we at North Bay have not had the resources to bring to date. But this has been, it's excellent. It's just well thought out, it's excellent. And I just came from a behavioral health symposium for California Hospital Association, and I have to tell you that the community paramedic opportunities were mentioned in several sessions.
It's not just going to be about picking somebody up, taking them to the hospital. It'll always be that, but we need to figure out what's the extension of that. How do we keep people from activating the 911 system? How do we keep them home healthy and educated? Those are the important things that this program's going to do.
I'm hoping that when this program comes out, that this program is replicated throughout the country and everyone can take advantage of the same program that the residents of Solano County can now take advantage of.
That was amazing, Jimmy. Have you gotten much feedback from that show?
We've got a lot of feedback from the program. The program's been fantastic. The patients have received it very well. It's we use a third-party service to actually get our patient satisfaction, and the patients love it. And North Bay and us meet regularly. It's a big program where we put a lot of effort into it, and it's been just a fantastic collaboration.
You can see in the faces of the people you're talking to that was sincere. I mean, that was not rehearsed. They were really deeply touched. And I can tell you as a physician, one of the number one complaints that we hear from patients is that either they can't access health care or the appointments are so short that they don't really have time to talk about their concerns to their doctor or physician's assistant or whoever it might be. So just having somebody knowledgeable work with someone and go through the medications and allay their fears, I mean, that's huge.
It is huge, because what the hospital doesn't see when somebody wants to discharge is they want to get home. And sometimes there might be a big vital piece of information that our community paramedics can see with their own eyes inside the home, and it ends up becoming just a great win for us and the hospitals and the patients.
So I want to change gears a little bit. This is Medicalert Awareness Month, and I realize that there are private companies that may produce some of these devices, for example, necklaces or bracelets that advise people who are coming up to an emergency situation that the person who is injured has some kind of health problem. We're not focusing here on Health Focus on any one particular company or any one particular proprietary entity. But I do think what's important, and I think having discussed this with you a bit off air that you would probably agree with me, is that people make an effort to have some information on them physically when they're out and about, so that if they have a health emergency, the responding paramedics will have something to go with, particularly if an individual is alone or, in a coma or a situation like that. So that's sort of what Medicalert Awareness Month is about. Do you have any thoughts about that just in general as a paramedic?
I mean, you hit it right on the head. It's very important for the patients, especially if they're going to be alone, have a way to communicate that information to the responding paramedics, because diabetes is where we see it a lot, where a patient might get a low blood sugar, they're by themselves, they might be unresponsive. We have ways of checking that and assessing it, and we see that, but it's really nice sometimes when we have a way to know on them diabetic or insulin or those, just whatever triggers that we can see through the medical alert process, through even having a note or whatever processes are available. It gives us a leg up in treating the patients.
So something is better than nothing.
Absolutely, 100%.
And you know, some of us, I have to admit, I've done this myself on occasion. I'll go out jogging or whatever. I might not have a scrap of information on me.
Yep.
But, you know, I'm actually aware of cases where someone has collapsed with a heart problem, for example, and that's not really a good thing, because then no one knows who the person is. No one knows if the person has high blood pressure, diabetes, heart disease. It's a problem.
It's a very big problem.
Okay, so for example, when you pull up as a paramedic, do you look for a bracelet? Do you look for a necklace? How do you go about checking someone for these devices?
So in a case where they're by themselves, that's going to be, we're going to look for those types of devices. We're going to check their necklace. We're going to check if there's, like I said, if there's a bracelet. We actually, Medicalert has an app that we developed, not developed personally, but through a development company to get medical information, be able to put on their iPhones or Android devices, so that when we get on scene, there can be an emergency contact who would have the passcode to open the phone for the patient, and then, or they could keep it unlocked, and we would get the emergency information like medication history, allergies, so that we know what's going on. When somebody's unconscious, it's also important to try and be able to identify that patient, have a way to contact family, an emergency contact. So there's just so many pieces when somebody's by themselves that we can contact and get vital information, because it happens more regularly than we think.
I know that when I was in the military, it wasn't a matter of deciding. It's simply part of the process. And so, for example, going back to World War II, enlisted people who were out in combat, they had dog tags.
Right.
And in Vietnam, but you know, that was before my time, but I mean, that's something that persisted. And clearly that's something that can be done on an institutional basis. But do you have any examples of any time you've come up to a situation where somebody has actually had this information and where it's really helped a person?
You know, mainly it's where somebody's unresponsive, and let's say it's not a diabetic, because those ones we can check sugar and we find out very, very quickly what's going on. As a paramedic, we have the tools to, you know, do a kind of overall assessment, but it does give us a very good head start on what I'm treating a patient. You know, especially when I was an EMT before the paramedic tools, when I arrived and somebody was unconscious and there wasn't their blood sugar, and you see the Medicalert and you see that they have, you know, history of you know, coronary artery disease or, you know, heart problems, and that they're taking nitroglycerin, and then you're like, okay, this could be more focused towards a cardiac event, so we can alert that to the incoming paramedics so that they're ready to go and they're going right to the heart monitor, not wasting time with other things. It's just that base information that it gives the responding providers. A lot of it too, a big is patient identification. A lot of them have the name
Right.
and a contact number, and that in itself can be the most valuable, because patient might have a unique heart condition that we can't give something. So those are also important to the allergies, or to know what we can't do to a patient, or you know what unique issue might be going on. So the emergency contact information sometimes that they have on them, or just the can't have this. Those are important pieces of information that help responders.
I think it's also worth noting that these devices are not just clunky, unattractive devices as they were, you know, decades ago. I've looked online. I think we even have a few photographs of some examples of some devices. And you can get bracelets that are made out of more natural material, that are less obvious, that are less obtrusive, that are more attractive, and so forth. And I guess some people might wonder, is there a privacy issue with this? But I don't know. What do you think? I don't think most people are going to be checking under your emergency alert bracelet.
I don't think it falls into a privacy issue. I think it's the patient's option to put it on there or not. And if you want to respect your privacy, you have that right. You know, you have that right to not wear it. You have that right to not use, in a case of emergency application on your phone, to not. Patients have that right. That's a great thing about being a patient. You have a lot of rights.
Right.
But it's in everyone's best interest for you to consider that and not worry about that don't put your social security number on it, right? I mean,
Right.
but I would put like your name and the things that we need to know, and even emergency contact information for somebody that has your unique medical information that we can contact.
I think you said it about as well as anyone can. And I can't help but wonder as we're sitting here talking what this conversation might look like in 50 years. Because I think with the advent of things like chip technology and communication via satellites and so forth, that we might eventually have a situation where somebody could have information inserted electronically that could be transmitted to a universal electronic medical record. But I think that's way in the future.
What I hope to see more is a pooled data between hospitals, first responders, the state, that we can pull that medical health information. Some counties in the state are looking at it. Some states are already ahead of us. Because then all we really need is a name and a date of birth.
Right.
Or just even a name where we can find, and then by attrition find which one's our patient. That's a big part of responders, because when we can walk in and get somebody's past medical history, that's very important to what we do.
Jimmy, this has been such a great conversation, but our time is coming to a close.
Great. Thank
But
you
I
very
really
much.
want to commend you and Medic Ambulance and all of your fellow paramedics for the fine work you do for the community, and I hope that you continue to stay healthy and continue to be able to do these important jobs that you're doing
Thank you
for
very
all of
much.
us. And, this has been an informative hour. We tend to think about emergencies as something that happens during the summer months, so obviously we focus on this during the summer months. But in fact, 365 days a year, it's very important to think about having your medical information available for first providers, whether you choose to do so by putting a note in your wallet or having a Medicalert bracelet or necklace or something else. But I hope that this has been helpful to our audience. Remember, here at Health Focus, we focus on your health. So until next time, all of us here in the studio wish you the best of health. Thank you for joining us. Hey, that was fantastic.